Happy Friday, everybody, and welcome to the internet's greatest show about plastic surgery, health, and beauty. This is Nip Talk. Today's segments, first off, the newest plastic surgery trends for 2024 have just been released. Some pretty good information, and we're going to talk about it. And then, is it possible an unqualified surgeon might be operating on you without your knowledge? A new article says that might be a possibility. And then finally, drug prices for prescription drugs have gone up almost 40% in the past decade. Why is that? We're going to break that down, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really appreciate it. Please hit that like and subscribe button because it helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is the awesome Sarah.
Hi.
Hi, awesome Sarah.
How are you?
In the box, we got Travis. How are you, buddy?
I'm great. How about yourself?
Doing great. Everybody have a good week?
Yes.
Yes, indeed.
All good things?
All good things.
Yeah? Anybody got 4th of July is what, next week? Next Thursday. So
Next Thursday.
I'm going to like an early 4th of July party.
Are
My
you?
friend always has like a huge
So like a
party
house
and-
party?
Yeah, but she has her own fireworks.
Oh,
and all kinds of
really?
Stuff. Yeah.
So
it's
this is
pretty cool.
like full on. Very nice. Travis, any big plans?
No, none.
Nothing. Take it. Sometimes it's nice to take it easy, you know?
Absolutely. I'm looking forward to nothing.
We haven't even like talked about what we're gonna do. We usually will go somewhere like a city festival or fireworks show or something.
Right
Yeah.
on.
I feel like you have to go do something, or sometimes we have a cookout.
Oh,
Yeah.
yeah. You know what? Like Clyde Warren Park, I thought about going down there to watch the fireworks.
Yeah.
Because they'll have like a fireworks show. So
Where's Clyde Warren at?
It's like downtown Dallas. It's that park that's over the freeway, over top of the freeway.
Where? Which freeway?
And it's off of like 35. It's like over 35 before you get to the Margaret Hunt Hill Bridge.
Okay. Yeah, I haven't been. I'll have to check that out. Is it pretty cool?
It is. It's just basically like a park that's over top of a freeway.
Wow.
Oh yeah, I know what you're talking about.
I haven't
Yeah.
seen that. It must be like somewhere I don't know.
It's over by a museum.
Yeah, it's over by
Like the Pro Museum?
Museum of Arts, Dallas Museum of Arts.
Oh, okay. All right. That sounds pretty cool. And so they have fireworks up there?
Yeah, they have a show.
Nice.
Absolutely.
It's kind of a bummer that 4th of July is in the middle of the week. I guess a lot of places are doing 4-day
I'm
weekend.
off
Are you?
Wednesday, Friday, and
Are you
Thursday
really?
and Friday.
I'm
Oh,
lucky.
wow. That's good.
I'm just off Thursday, although I may be on call. I don't know. I haven't had a call scheduled for July, but I know I have to work Friday. But oh well, it's all right. One day off is better than none.
That
Yeah,
is true.
absolutely. 100%.
All right, well, let's jump into some segments. So, you know, if you guys remember, which you may or may not, we actually did this segment last year about this time because at the beginning of the summer every year, the American Society of Plastic Surgeons releases all of their data for the previous year. So this is the data from 2023, and so we call it the 2024 trends because obviously the data is not necessarily captured in real time
Right.
and release. So I think that this is really good information for both surgeons and patients to see what are the plastic surgery trends for the previous year, because you see overall, you know, is plastic surgery increasing, is it decreasing, and then in that you can look at the different subsets of operations and see, you know, what are the numbers, you know, what is some of the more popular surgeries, what is the increase, because that does weigh into, you know, how good a surgery is. If there's only a few thousand of a surgery being done, either it's for something that's really rare or maybe the results are not as great and so satisfaction rates are a little bit lower. So
Right.
I always find this data pretty interesting. I mean, part of it's from a business aspect, you know, seeing, okay, do we need to change our business model based on what people
Yeah.
are seeking? But also just to kind of learn about, you know, what procedures are hot and what's not, what's on the downtrend.
Definitely.
So yeah, I thought this was pretty good. Okay, so overall for 2023, there was a 5% increase in surgeries. So
Okay.
just surgeries. We're not talking Botox, we're not talking lasers, fillers, just overall surgery is a 5% increase. So in 2022, there was 1.49 million cosmetic surgeries done in the United States. 2023, 1.58 million. So a 5% increase is pretty standard. You know, that's encouraging because I think that the last year the economy has not been as great as it has been in maybe the previous years. And you always wonder, what's going to start trending downward when the economy starts to shrink a little bit and people are tightening their belts. Well, obviously it's not plastic surgery because those numbers are up. Non-invasive cosmetic procedures. So this would be like your Botox, your fillers, your lasers. It increased even more, 7% increase. So there was 23.6 million in 2022 and 25.4 million procedures done. That's pretty crazy. That's a lot. But things like Botox are very common, so it's not surprising that those numbers are higher.
I literally just got some yesterday.
Where'd you get it?
You.
I know. I probably hadn't started yet. It's a little early. Your Botox looked great last time.
Yeah.
I thought it looked really good. So I hope you like it. You'll have to let me know. Well, I guess next or a couple weeks from now we'll see how it's going. So, all right, but I did want to break down each individual one because as consumers, it's good to know what's popular because, like I said, more often than not, surgeries that are popular for a reason. So the first group I wanted to break down, and here, actually, Travis, throw up that next slide because I just wanted to show this. It's not really zoomed in, but if anybody out there is watching this video wanted to get a complete breakdown of the numbers from year to year and then the change, percent change, this is it. You can pause the video. I think on a computer screen it should be pretty legible, although here in the studio it's pretty small. And I'm going to go over some of the highlights. So the first big category there is breasts. So there was about a 5% increase in breast surgeries across the board, 600,000 total breast surgeries. And these are cosmetic, not like cancer, not reconstruction. This is totally cosmetic. So breast surgeries made up 38% of all plastic surgery procedures. That's pretty crazy. That's nearing half, not quite, but
That's believable though.
yeah, I mean, breasts are one of the absolute most popular surgeries. Of those, breast augmentation led the way. Now, they lump breast augmentation in with implant exchanges, so, and I think that's fair. I mean, it's, breast implants, whether you're putting new ones in or changing them out. The one thing I would say about breast augmentation is, although it's number one at 304,000 total surgeries, the percent increase was actually fairly low, only 2%. And so you wonder why that is. I mean, is that because of, the concerns? We've talked about that really rare breast cancer that comes from the textured implants, which really is not an issue in the United States because we don't use those. We've occasionally talked about breast implant illness, which also is very, very rare. It affects less than 1%. But you wonder if those things popping up in the media has maybe scaled back the number of people seeking out breast augmentations. I mean, that's totally possible.
Definitely, yeah.
The other reason might be that we're seeing less and less saline implants these days because of the rise of silicone implants. And because of that, silicone implants tend to be changed out less frequently. And so that might be affecting the numbers as well because the implants are just lasting longer. And so because this is both new augmentations and implant swaps, maybe that's why that's down. But I thought that was pretty interesting that number was not, although it's the highest one, it doesn't have the increase rate that some of the other ones did. This one is going to be pretty surprising, although I totally expected it. There was a 9% increase in implant removal surgery.
Yeah.
And we've talked about that in a recent segment, that I'm seeing a lot of people removing their implants. And the reason for that's pretty straightforward. The lifespans of these implants are 15 to 25 years, depending on if they're saline or silicone.
Yeah.
And there were so many implants done in the 90s. There were implants done in the 70s and 80s, but in the 90s, the numbers really started skyrocketing. And so all those people in the 90s who have their original implants now are needing to do something. And a lot of people are deciding that, maybe I just don't want them anymore.
Yeah.
That's pretty common when people get older, that they, especially if they, have changes in their body, like if they gain weight, and their breasts get larger, they're like, I just want to take out my implants. And
Makes sense.
yeah, I mean, it's common. I do a lot of consults for that, and I'd say I do at least a couple, if not 3 of those surgeries every month. The only thing about that is when you take out the implants, generally you have to do a lift because the taking out the volume makes the breast fall, and people don't want that. But 9% increase. Breast lift and breast reduction remained very popular, 7% increase. Breast lift was about double reduction with 153,000. Breast reduction was about 76,000. I do tons of those. They're very, very, very popular surgeries. This one's kind of interesting too, gynecomastia, so male breasts.
Yeah.
Not a huge number, 26,000. Comparatively to the other breast surgeries, but it was a 6% increase. And, I love doing gynecomastia surgeries. I did one last week. I do probably a couple a month, 1 or 2 a month, I'd say. Yeah, probably 1 or 2. But I do them pretty regularly, and the nice thing about fixing gynecomastia surgery, if you've done some, it's pretty easy.
Right.
Of all the patients I've done for gynecomastia, I've never had to take one back surgery, and across the board, everyone's been happy. So good surgeries. Bummers, just insurance won't pay for that. So with the breast stuff, a couple interesting things. I think the slowing down of implant-based surgery is interesting. Is it a big deal? Probably not, but it's some interesting stuff. So moving on, body surgery. So body surgeries made up 38.5. So breast and then all of body were roughly equal as far as number of surgeries. 607,000. That's a 5.7% increase. Of course, the one that I was interested in is Brazilian butt lift. Because we always talk about it, and I'm convinced that Brazilian butt lifts are eventually going to slow down. And I was interested because last year it was stable. I think that the change was less than 1%, if I remember correctly, because we talked about this a year ago. So this year it actually went up a little bit, up to 3%. But the total number of cases remains pretty small. 29,000 total Brazilian butt lifts in the United States, which is less than 10% of the number one surgery in the body, which is liposuction.
Yeah.
So Brazilian butt lift did gain a little bit of popularity, although the overall numbers comparatively are pretty low. And I think that's for good reason. There's lots of people out there like me who say this is not a good surgery, but there's still people out there having it, which, I don't think it's crazy if someone has it. I just don't recommend it.
Yeah, not the best decision.
Liposuction far and away was the most popular. Also, the number one plastic surgery was liposuction. Second was breast augmentation. Liposuction, 347,000 procedures, which is a 7% increase. I have to say that probably these are combo cases, meaning I don't believe that there were 347,000 people that just got liposuction.
Yeah.
It's like liposuction with the tummy
combination
tuck,
with something,
liposuction with the arm lift. Because I do liposuction literally all the time, but it's almost always in combination with something, and I'm pretty sure that those cases were probably tied together. Body contouring is on the rise, 8% increase in arm lifts. And I've seen that too. I think between weight loss surgeries and things like Ozempic, Mounjaro, people are losing a lot of weight pretty easily these days, and they're getting loose skin and they're wanting to get it taken care of. So 8% increase in arm lifts. Numbers weren't super high, 23,000. Thigh lifts, not quite as popular surgery. I like doing arm lifts better than thigh lifts. I just think arm lifts are a lot more dramatic. Thigh lifts, are good. They're not my favorite. There was only a 2% increase in thigh lifts, only a total of 9,000 surgeries, so pretty low. And then the other big one in body is tummy tuck. This is always going to be popular. Not only do you have the weight loss people, but then you have the post-pregnancy people. And as we've talked about in the past, a lot of women who go through pregnancy, especially if they're multiple pregnancies, get changes to their abdomen that they can't fix in the gym.
Yeah.
Do you see that I know you're in the gym a lot and doing CrossFit. Do you ever have girls in there that talk about, I'm trying to fix this thing on my stomach, but I can't?
Yeah.
It's pretty common.
Yeah.
Yeah.
I coached a class on Saturday, and one of the girls
You're
was
coaching? What were you coaching? Just CrossFit?
Yeah. I just coach sometimes.
Is that like a paid thing or?
Yeah.
Wow.
Sometimes I do it. Sometimes it's just when I fill in whenever. But one of the girls was
do you
talking.
drive them really hard?
No, I don't think so. I might, but yeah, one of the girls was talking about it.
We should do a segment where I come and try and do one of your CrossFit things.
You should try it.
There was a time when I used to be really
I would
into
recommend
CrossFit.
doing it now because it's so hot outside.
Yeah.
But yeah, she was talking about how she wanted to get a mommy makeover.
Yeah.
And I was just like, you can't really fix it at all.
You're like, I know all about this
Yeah.
because I'm an expert on plastic surgery. Not because you've had it, but because you've been here. But yeah, so tummy tucks are going to always be popular. 170,000 tummy tucks done. So that's a 5% increase. And then moving on to the last big category, which would be face. Makes up 23% of surgeries. That's actually smaller than I thought it might be. 368,000 total surgeries. That's about a 5% increase as well. One of the ones I was interested to see is buccal fat removal. 7% increase in buccal fats. Now the numbers are really low, 4,000. So not a whole lot of that being done, but there was an increase, which I think probably
in
a year.
Why. Social media.
Yes, social media totally drove that one for sure. I think eventually, and it may take years, but I think eventually that one's going to trend back down.
Can you put buccal fat back in your face?
Yeah, you can do fat grafting. That actually was one of the categories. I didn't pull that one out because it's not insanely popular, and I'm not a huge fan of doing fat grafting to the face. With fat grafting, as we've talked about, there's the reabsorption issue. There's also the chance that it hardens up, and so I'm kind of iffy on doing it on the face personally.
Yeah.
Although I do fat grafting from time to time. In fact, I did.
Do you remove it from inside their mouth or on the outside of their face?
Are you talking about for buccal fat? It's from the inside. Incisions are on the inside, yeah. Eyelid was the #1 most popular face surgery, 120,000 surgeries, 5% increase. Facelift and neck lift, also popular, 78,000. Neck lift a little bit less, 22,000, which I thought was interesting because I always do facelift and neck lifts together personally. I mean, every once in a while I'll do them separate. The reason for that is because the incisions are the same, and like you're in there and you can always gain a little bit of ground, so it's like, why not just do both,
right,
in my opinion. And then finally, rhinoplasty, 47,000 surgeries, 6% increase. So nothing too shocking in the surgeries. There was a couple things that kind of made me go, but nothing really, groundbreaking. Last one is non-invasive stuff. So I throw that last pickup, Charles, so people want to see what the non-invasive procedures done. They kind of grouped some of them together oddly. Like they separated lip filler out from like face filler. They combined lasers and microneedling, which I thought was weird, but they're, it still is pretty good information. So Botox leads the pack, 9.4 million Botox procedures done, which is a 9% increase, so that's rising. Lip filler, 1.4 million, that was 4% increase. Fat reduction, so this would be things like Cool Sculpting, M-Sculpt, there's one other one out there I can't remember right now. This one was kind of surprising to me, a 9% increase in non-invasive fat removal. So
does that work really well? Or is it like,
It just depends. So I have a Cool Sculpting machine that we don't use anymore because I just think it's a little inconsistent. You'll have some people that will get a pretty good result and then other people that don't. And, it's fairly expensive to do it. There's also that really rare risk with cryolipolysis. Took me a second to get that out. With cryolipolysis, where the fat actually hardens. And remember, Evangelista, is it Linda Evangelista, the model?
No, I don't remember.
Oh, that might have been before your time. So there was a model that actually had that really rare complication where the fat hardened up.
Oh, no.
So I quit using my Cool Sculpting machine, but I was interested to see that there was a 9% increase. Now, M-Sculpt Neo is like the kind of the new one that both builds muscle and reduces fat. So I'm wondering if maybe that might be driving some of it because you see a lot of ads for that. But then Cool Sculpting also. Lasers were pretty popular, 6.6 million, and that does include the microneedling like Morpheus. Facial fillers, 5.3 million, pretty high, 8%. Yeah. And then finally, the non-hyaluronic acid fillers like Sculptra, increase of 8%, up to almost 1 million. So I think it's important to know these trends if either you're a plastic surgeon or you're thinking about having a procedure of some sort. There is data to be learned because I think if you went to the average person on the street and said, do you think Brazilian butt lift or buccal fat is like a really popular surgery?
Yeah.
They're probably like, oh yeah, they're insanely popular. That's all I see on my social media feed.
Yeah.
In reality, comparatively, they're not popular.
No.
And so it's like, okay, well, why is that? Well, because a lot of people think that they're not necessarily the greatest surgeries. And then other things like, mommy makeovers, breast lift, the numbers are just huge and for good reason because, they just have years and years of good results. So interesting. I like doing that. I like checking out the latest trends in plastic surgery because, obviously we have a show about plastic surgery, so it's good to know that.
Stay on the trends.
Yeah, we got to stay on the trends. In fact, I sent, some of that information to my office manager who also runs a med spa, because we think about like what machines we may or may not get. It's good to know, okay, people are asking for this or people are doing
this is on the rise.
Yeah,
better look into what we need to get for it.
All right, moving on. Next segment. This one was interesting. I saw this article pop up, and then I saw a bunch of people talking about it on social media, and so I want to talk about it, but I'm going to talk about it for kind of a different reason than maybe the thrust of the article. So this segment comes from a recent $15 million fine paid by 3 hospitals and medical groups in Houston. It was Baylor St. Luke's Medical Center, Baylor College of Medicine, and Surgical Associates of Texas. And the topic that I want to talk about is it possible that an unqualified surgeon may be operating on you without you knowing? And the reason that this is tied to this big,
So that's scary.
It is and it's not. So that's what I want to talk about, because when this story kind of landed, here, throw up the article. This is the article that I was reading. Yeah, Texas Medical Institution agreed to pay $15 million. So this didn't necessarily talk about it in the title, but when you started reading this article, it went into the details. It started from a whistleblower in 2019 that said 3 heart surgeons were each running 2 different OR rooms and was delegating key parts of the heart surgeries to unqualified medical residents. And so, of course, like when social media saw that, there was kind of this outcry of, how are they letting unqualified people operate on you? Mm-hmm. And of course, this is just wrong, like when it says medical residents. And what I mean by that is, when you say someone's a resident, that means they have a certain amount of training.
Yes.
All right? The people that work with cardiothoracic surgeons are not residents, they're fellows. And so there's a really, really big distinction in that. And I want to kind of go into that because I think that there was a lot of fear generated from these articles talking about this judgment that probably is not warranted. Because I do think that the way that the article is written, and I probably should have pulled up the excerpt that had that said unqualified medical residents, that's just absolutely false. It's absolutely incorrect. So obviously there was an issue with the billing with these groups because there was a fine paid out. $15 million is pretty significant. Most likely what happened is they were billing incorrectly, probably billing for being present for a whole surgery when they were only present for part of a surgery. And since I don't bill for that type of surgery where I have somebody under me, I couldn't tell you the exact specifics, but there are certain guidelines for how you bill that. Mm-hmm. And when you're dealing with the government, with Medicare, they don't fool around. If you do it incorrectly, they will slap you. And this is a classic example of that. And so, as I said, I want to talk about the resident part because when I saw that and people were freaking out, I'm like, this is normal, okay? It is very, very normal if you're in a teaching hospital that your surgery may be done by a resident and you may or may not know that.
Yeah.
Now, all of these teaching facilities do have to declare that they are a teaching facility and that there is a chance that you will be seen or treated by a resident doctor or a doctor in training.
Yeah.
In fact, the trauma hospital that I work at has residents, and I see they have little posters up everywhere that says, this is a training hospital, this is a teaching hospital, you may be treated by a resident.
Right.
And so I want to go through like the different levels of resident, and eventually I'm going to tie this back to the story and talk about, okay, if you have a doctor in training, what does that mean? Like, what does their level mean? Because, there's a lot of words thrown out there: intern, resident, fellow. I mean, you guys have heard those terms, right?
Yes.
Do you know what they mean really?
I'm guessing an intern's pretty low.
Yeah, that's going to be the lowest for sure. Yeah. So you're right. Interns are the lowest. So the way that we classify residents oftentimes is by PGY level. So that's postgraduate year. So like a PGY 1 is an intern.
Okay.
All right. So interns are PGY 1s, and so what they do in the hospital is basic evaluations. They write orders for floor patients. They are in the OR if they're surgical residents. They may be doing surgery, but they're always going to be supervised, and someone's going to be like actually, watching them.
Yeah.
Yeah, they're going to be watching them like a hawk. Mm-hmm. Interns are not doing surgeries by themselves. Now, could they be sewing you up in the ER? Yeah, absolutely. I mean, they be doing simple procedures. But no interns are going to be doing anything of major critical importance. They're always going to be answering to residents. So as you go up the level, PGY2s, generally PGY2s, there's a steep learning curve in medicine, so PGY2s often help run ICUs. And that may have changed a little bit. When I was a resident, PGY2s always ran the ICUs. I mean, because of work hour restrictions, that may have been bumped up a year. But PGY2s are going to be doing more. But in the OR, they're always going to be with another, probably attending, sometimes maybe a chief resident doing cases, but they're not going to be doing anything by themselves of any importance except maybe putting dressings on or maybe closing small incisions.
Right.
Going up to like mid-levels like PGY3s, like these are going to be pretty experienced residents at this point. They're going to be taking care of like very critical patients, like maybe trauma patients, like in the ER, doing the initial evaluations for their upper level residents or attendings. They'll be actually doing a lot of surgery in the OR, but it still will be under supervision. they're going to have either a chief resident working with them or a fellow or an attending. And so someone of higher level is going to be watching them. As you go up to like PGY4, I call these baby chiefs because they're considered chief residents, but they're not the highest chief level. They do a lot of supervision. They're not going to be quite doing as much like the grunt work. They'll be doing a lot of surgery. They may be doing stuff with the attending scrubbed out at that point, but they wouldn't probably be doing anything critical. They're going to be doing really routine stuff, nothing out of their scope generally. So when you get up to PGY5, so this is considered a chief resident, at least in general surgery, and in almost all other surgical categories except for something like neurosurgery, which is longer. So PGY5s or chief residents can operate independently. I mean, they can run their own ORs. Now they still
like the word resident kind of firms up what they're allowed to do. It's like that's their hospital now.
Yeah. So and that the reason that resident is the name they called them, because initially when you were a resident, you lived in the hospital. Like that was your residence because it was so intensive that people didn't go home. They lived at the hospital. But yeah, so PGY5s could be operating on you by themselves, and that's very, very common. In fact, when I was a PGY surgery chief at a level 1 trauma center, we did not have attendings in-house and we didn't have fellows in-house, meaning I was like the highest ranking surgeon in the hospital at a level 1 trauma center doing surgery. Now that was a few years back, so I was a chief resident in 2007, so I'm not sure that happens these days, but I guarantee you that there's still PGY5 chief residents operating on their own. Ultimately, the attendings are responsible for them, but they absolutely could be operating on their own, which means that, you could have a resident doctor operating on you. Generally, you would know that because they're going to tell you they're a chief resident, but it does happen. Now, I'm moving on to the next step, which is fellows. So what it means when you're a fellow is that you've completed a residency. Like you've done a residency, but you want to go on for further training. So I did a plastic surgery fellowship. I was already a general surgeon. I had completed it, but I wanted to go on for more training, so I became a fellow. I actually did 2 fellowships. So this could be a PGY6, PGY7, PGY8. So these guys are the ones that were operating on these patients. Most likely that they were PGY7s. Like these are surgeons who have already completely finished a surgery training program, but now they're doing cardiothoracic as a fellowship. So these guys are going to be very well trained.
Yeah.
To have these guys operating by themselves, even on critical stuff,
normal
is not a big deal. Yeah. When I was a PGY6, PGY7 plastic surgery resident, we were doing microsurgery on our own. We were sewing blood vessels together on our own with no attending in the OR. That was 100% normal. Yeah. As it would be to have a cardiothoracic fellow doing heart surgery. I mean, we did heart surgeries as PGY5 general surgeries. We did sternotomies, we did thoracotomies for trauma. We weren't doing bypasses, and those are a little bit more complex. But the point I wanted to make is that all of the fear mongering that popped up based on this judgment about unqualified residents operating on people was just not
silly.
Yeah, it's not accurate. I mean,
they sounded like they needed to write an article to scare people.
Well, I mean, it's a lot.
Looking for something
like
to
fear sells, right?
Yeah.
And so I saw a couple articles that were kind of like focusing on that part as opposed to the actually important part, which is these guys messed up when they were billing and they got slapped for it. And so, and I do think it's important for people to know, when you go into a teaching hospital, what does that mean? Like, obviously medical students are kind of, down towards the bottom. Then you got your residents, but then there's a whole, host of different levels. Then you got the fellows. For the most part, these teaching facilities, especially these days, people are supervised pretty well.
Right.
When I went through, there was not as much supervision, but also residency was different. It was more intense. And, when I was a PGY5, I felt very, very comfortable doing basically anything. So, we were operating on our own, even as PGY5s. And then same thing when I was a 6, 7, and 8, because, you're talking years and years of training. That's after medical school. Yeah. So, but yeah, I just wanted to kind of dig into that because, I see stuff where it's like, oh, this is being sensationalized and it's, there's already enough, doctors are catching enough flack already. We don't need like untrue things to be said about us to make it worse.
That's pretty wild when you consider that article to like the articles that you found about plastic surgeons that are not like
I
accredited.
know, right? Yeah, exactly. Like,
I'm
where's the
like-
fear mongering for that? Like, I'm all
Yeah.
for fear mongering about like these unqualified. Those are truly
Yeah,
unqualified
a
people.
general surgeon doing
Yeah, doing
like,
specialty surgery.
yeah,
Yeah, it's craziness.
yeah. Or not even being,
Well, that's why we do this.
Certified.
I mean, you know, I really do believe that the biggest reason that we do the show is to educate people and try to protect people.
Yeah.
You know, I mean, we don't always talk about topics that maybe protect people, but we do a lot of topics about, hey, this happened. This is what you need to
prevent
know.
ignorance. Yeah.
Yeah, right. I mean, knowledge is power. So.
Yeah,
Right, Travis?
sure.
You've been kind of quiet in there. You okay, buddy?
Uh-huh. I am.
Okay, I know you're busy in there. I can see that. All right. Okay, moving on to our final topic this day, which I hadn't noticed this personally. Have you guys noticed? Oh, I don't want to dig into if this. I'm going to ask you guys this, but feel free not to answer. If you use any prescription drugs, have you noticed an increase lately, like in the past 10 years? No?
Not necessarily.
No.
I have asthma, so sometimes I'll
Okay.
use like an inhaler. But
Okay.
it's still about the same price, I guess.
I haven't noticed it either. I take one prescription drug. I've talked about it. I take finasteride. I've taken it forever. It's the one that prevents hair loss.
Yeah.
That stuff is dirt cheap. I hadn't noticed this, but news article came out that said that in the past 10 years, so since 2014, prescription drug prices are up 37%. So that's almost 40%, and that far surpasses inflation. Inflation is 19%. So drug prices have gone up double what they should have if you would base the cost on the inflation rate. And that's interesting. So why is that?
Yeah,
well,
why?
Huh?
Said, yeah, why?
So like everything, it's multifactorial. One of the biggest reasons that I found is because insurance companies are covering less.
Oh, that makes sense.
Yeah, I mean, if the insurance companies aren't covering the cost of your drugs, then who gets the cost, right? They pass it on to the consumer. So what's happened with the insurance companies? Well, in the past 10 years, deductibles have doubled. So like the deductible that you have to pay before the insurance kicks
Yeah.
in. So that's pretty notable. Copays have risen a lot. So now there's 20% left coverage. So you know when you buy a drug, like here's your deductible, but then there's a copay, right? You have to pay X amount of dollars. Well, that amount that you have to pay has gone up about 20%. And then now we're seeing a lot of insurance at a second tier, meaning for certain drugs, they get bumped up into a new category where you actually have to pay more. And yeah, that's kind of crazy.
That is weird.
It's different. So if you're buying generic everyday drugs, blood pressure medications, things that are very common, they're going to be like the lower tier, right? Because they're dirt cheap, they're generics and all that. But some of these more expensive drugs, things like cancer drugs, things like some of the diabetes drugs, they're kicking these things up into these
Is
higher.
that semi-glutide in there?
I don't know. That's a great question. When I said that, I was
Because
like,
it's
oh.
prescribed
Yeah, I
sometimes.
bet it probably is in that higher tier. I would bet because
Yeah.
that stuff is expensive when you get it. When you get the name brand like for example the Mounjaro, the last time I checked that was over $1,000 a month. And so probably for those more expensive drugs, you're going to end up paying more out of pocket. And Americans do pay more out of pocket. Americans pay 2 to 3 times more than other developed companies for drugs. And once again, the reason for that's multifactorial. So, not only has insurance companies started paying less, like the price of drugs have gone up, right? And so you're getting hit by 2 things. You're having to pay more because insurance companies are paying less, but then also the cost is going up.
Yeah.
And people always ask, so why are drugs so expensive? And so this is where I try to play devil's advocate on this, because obviously, your first inclination is to say, oh, they need to lower the price of drugs. Well, I mean, a lot of people say that. It's like, okay, drugs are really expensive. We need to lower the price. Well, there are downsides to that. I know we talked about this in one segment. It's been a while, but we were talking about drug companies, and we were talking about how in the United States, we are responsible for the overwhelming majority of development of new drugs. Like compared to other countries, like combined, like we outpace them in the development of new drugs by a large margin. Why is that? Well, because drug companies can actually afford to do it here in the United States. It costs up to billions, like billions with a B, to make a new drug, to go through the trials, to produce it, to do the marketing, do the studies to show it's safe.
Definitely.
And so if you cut the costs too much and these companies don't make any money, you are going to stifle new drug development. And that's a big deal. I mean, things like, these new diabetes drugs that work great for diabetes and are also great for weight loss. The new drug that basically cured hepatitis C, like the cancer drug my mom takes that basically is saving her life. These are all brand new drugs that were developed because companies have this ability to upfront the cost to develop something new. I mean, drug companies make a lot of money, but they also outlay a lot of money as well. And I'm no fan of drug companies. I don't own stock in them. I have no ties whatsoever to drug companies. But
isn't a paid advertisement?
No, it's not. I mean, but I see the big picture. I mean, it does cost a fortune to develop a new drug. And a lot of times when you start to make a new drug, it doesn't work, or maybe the side effects are too bad, and you may have spent, $100 million on it, and it's not going anywhere, and you have to eat that.
Maybe that means that that increase, there's some of the bigger drug companies, they are developing some really
surely.
awesome stuff right now.
I'm sure they are. I mean,
And they just need the funding to get it there.
Yeah, I mean, and we just talked about one, was it last week or week before? We were talking about that new triple action GLP-1 agonist.
Yeah, the one we're that'd be cool if we took a pill that made us lose fat and gain muscle at the same
Yeah,
time.
I know, right? So yeah, I mean, they are developing new drugs because, I mean, I'm sure that there is some altruism in it. They want to cure these problems for people, but also there's money in it too. If you come out with the next semaglutide, your company's going to do really well. The other reason drugs are so expensive are due to the regulatory and marketing expenses. Like the approval process to get drugs on the market is
Very
insano. Oh, it's enormous. The Food and Drug Administration, obviously wanting to keep people safe, has all of these hoops that people have to jump through, which cost a ton of money. Patent protection is a thing in the United States, right? So that's not necessarily a thing all over the world. If a company makes a new drug, they have a patent for, 7 years?
And then a generic
Yes,
brand
I
can
think
come
it's
out.
7 years. So for 7 years, nobody can copy that. And so that increased costs, right? Because they don't have competition for the first 7 years.
Like a monopoly for 7 years.
Yeah, but what it does is that incentivizes people making new drugs. It's once again, if you take away their ability to make money, then you are going to potentially limit new drugs coming out.
Definitely.
There are limited competition for certain drugs, which means some of the more rare drugs, like some of the cancer drugs, because of the cost to make it and because there's so few people that might take it because it's a really specific cancer. I'm thinking like the drug my mom takes, for example. There's not any competition. There's one person that makes it, so they can kind of set the price. High demand. There's many people in the United States that are on multiple drugs and they have to take them.
Yep.
Right? And so if demand is high for something, cost is going to be high. And then finally is the lack of price regulation in the United States. We don't price regulate our drugs. I don't know if it's true that we don't do it at all. I don't think that there's a lot of price regulation on drugs. There's always talk about doing it, but there's not. Versus in other countries, there's big price regulation. But then again, you look at the United States and how many new drugs in the world are made in the United States, and I don't remember the exact number, but it's an insane amount. We outstrip everyone by a huge number. So, the next question when you hear about these drugs is how do you fix these problems? I mean, I know there's people out there that probably stress about, paying their copays for prescription drugs and
that's
their
scary.
drugs that they have to have. Yeah, I mean, it's totally crazy. I mean, and I've said this about other things that we've tried to solve. I mean, there's no easy answer for this. I mean, you can start to dig into regulation and stuff, but then what is the downside and is that worth it? I mean, would you as a person, and I'll ask to both you guys, would you be willing to see, a 50% decrease in the cost of your drugs if it meant that we had
It would take
20%.
10 more years to come out with another drug.
Yeah, would you take half the cost of your prescription drug bill if it meant that we only got 25% as many new drugs in the next decade? I don't know if I would take that personally. I mean, obviously that's not the best question for me because I'm not taking a whole bunch of prescription drugs. If you ask somebody that's taking a bunch of prescription drugs and that they're struggling to pay those bills, they may say, yeah, I would take that. Obviously, I'm struggling to even survive right now. But that's not everyone's in that position. I think one of the big things that no one talks about, or maybe some people do, if we want to make drug costs cheaper, is to lower demand. And I think that one of the best ways to do that is to make ourselves healthier.
Yeah.
Like
Prevention.
compared to the rest of the world, the United States is in terrible shape. You know, the levels of obesity, hypertension, diabetes are worlds above like Europe, for example. You know, and you see that when you go to Europe. I mean,
Yeah,
you know, more
definitely.
people walk over there. You know, the food's different over there. And I think in general, I mean, and I'm, you know, really pro-American, yay America, but like we're terrible as far as like our health.
Definitely.
You know,
yeah.
and we're also super independent. We don't want to go to the
Stubborn.
doctor.
Yeah.
You know, we don't want people telling us what to do. I mean, so it all of that together makes for a very interesting problem of, you know, drug costs are high and they're not, you know, not getting any lower. In fact, they're outpacing inflation, and it's a problem for some people.
Yeah.
You got a solution?
It's a seller's market.
It is a seller's market.
No.
I don't either. I mean, you know, the only thing I come up with is, you know, I
Just
would
be healthy. If you
Yeah.
don't want to pay a lot of money for prescription drugs,
Well, and it brings up the question of like, could you incentivize people to be healthy by having them pay less for certain necessary things? I mean, to a certain degree, health insurance does that, but not as much, I think, you know. But I think that might be a way. I mean, in a way, you're punishing people, but I don't know how else to
like
do
a
it.
rewards program.
Huh?
Like a rewards program.
I mean, I don't know. I mean, I think that you have to do something about the overall health of Americans. Like we're not in good shape, and we're getting worse. Like every year the numbers get worse for these things. And it's like, how do you fix this? I mean, how in the world do you get a group of, you know, independent people who don't want to listen to anyone and make them healthier?
Yeah.
I don't know. Thoughts? Travis, anything? We're struggling out here.
I'm struggling back here too.
I know. I mean, this is a big question. If we could solve this, we you know, be the next millionaires, I guess.
I think Sarah had a good point. Just try to be as healthy as you possibly can.
Yeah.
Everybody don't get that luxury though, but you know.
I know, right? And it's hard for people. I'm not just
Well,
saying
I
go
think
out and be
it's-
healthy. I
Yeah,
mean,
but I feel like I think the thing that makes America different than other countries is what is our main goal in life?
I think that's different for every person.
But I feel like Americans are like, our main goal is to make money.
I would say that's probably very true. We are very commercial.
And like Europe, I don't think, I mean,
Yeah.
I'm sure it is a very high priority, but I think there's just more like living.
Yeah.
Like that's how I see it over there. And America's more like, we don't have any time, we just have to make money, and my health is down here.
That's
money
true.
is up here.
I totally follow you now. Yeah, I agree. It's so like people are more concerned about like working and make. I mean,
So they put everything.
Dude, that's totally me. I
Yeah.
mean, you know, you guys know I work like all the time. I usually work 7 days a week, and like, you know, I got home last night, and I wanted to go run, and I was like, you know what? I'm just like beat. I just got home. You know, I need to like start, you know, dinner and doing stuff around the house. Like, I'm not going to do it.
Yeah.
But I got home late. You know, it's like if I had got home at a reasonable hour and had more time in the day, you know, I probably would have done it. It's like, because when you're super busy, like you start to cut out things, and a lot of times, you know, your health
Being
is
healthy
whether
is
it be
one of them.
working out or whatever.
Working out, cooking food at home.
Yeah, right? Yeah,
Those two
cooking
things
food.
always go when you don't have enough time and you have to put
Yeah.
your schedule of making money above
Right.
it.
Well, yeah, and it's like, okay, and you know, it's like last night I had to prep for the show because I have the side gig that I'm
Yeah.
doing, right? It's like, you know, I'm doing this because I think that it might be beneficial down the road. I mean, I like doing it, but
Yeah.
you know, it's like I have all these things that I'm doing that are work oriented, and it, you know, it does affect what I can do on a day-to-day basis.
Definitely.
I've been meaning to clean out my closet for like 6 months, and it's just like down at the bottom, right? I didn't really have to do with health, but you know, it's
There's so many things I've been meaning to clean
I know.
out.
Yeah, my list of things to do is like enormous, and if I get to cross one off, I'm like, yeah, like
And there's
got
just
something else.
20 more.
Yeah, there's like, yeah, at least 20 more. Well, it's a big problem, and it'll be interesting to see. You know, in another 10 years, will it go up another 40%? I mean, suddenly these costs are going to be out of control. Mm-hmm. Healthcare is a problem. I've said this many times. Our healthcare system, which I think is great, is broken.
Yeah.
You know, and I just don't know what the answer to it is. You know, I think it's a really big problem that does not have a solution.
Yeah.
So, but that's a topic for another day. I think we've hit the limit on depressing things.
We're like, I don't know anymore. I don't know anything.
Well, let me know what you think about prescription drugs. Let us know if you want us to talk about any specific topics. We'd love to hear from the audience. If you have something you want us to talk about, we would love to do that. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. We'll see you guys next week on Nip Talk.
Bye.
Bye.